All right, here we go. Hello, and thank you for watching this webinar on how to create a billing and coding policy manual. There's no audio taping or videotaping allowed, in any unauthorized reproduction, dispensing, forwarding, or copying of this target coding webinar is illegal. The information in this presentation is for educational purposes. It's not intended to substitute any of your thorough clinical decision making. Target Coding is not a law firm. We don't provide legal advice. A little bit about myself before we get going. My name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years. And then about 12 years ago, I started a company called Target Coding. I'm the president of the company. I also went for my certifications in compliance. So I'm a certified compliance officer. I'm a certified billing and coding specialist. And I consider myself a little bit unconventional because most chiropractors are not certified coders. Most certified coders are not chiropractors. So I could take this unique approach to helping doctors, assisting staff members with the clinical approach and the coding and billing approach to make everything come together so it's compliant. And compliance is what our specialty is all about. We want to make sure you're compliant as it relates to billing, coding, documentation, Medicare, HIPAA. Those are our areas of expertise. I've written many training manuals and books on chiropractic, billing and coding and documentation. I've also written manuals for physical therapists, acupuncturists, and massage therapists. I write articles to many publications and journals throughout the country. And I'm a guest speaker at many state association conferences nationwide. All right, so back to the topic, how to create a billing and coding policy manual. Well, I have a question for all of you before we even move forward. Why even have a billing and coding policy manual? You know, those are some of the questions I hear. It's just another thing we need to do, Dr. Kotler. You know, these are the things I hear. You know, more stuff for my staff to do. You know, don't we have enough going on, right? So why even create a billing and coding policy manual? Well, it's about being proactive. So here, you know, for staff members, your staff, doctors, you may not have asked your staff recently, but they want organization. They want to work in an ethical and trustworthy environment. They want leadership. How do you provide that? By giving them written policies and procedures. It creates a culture of compliance. Also, if you have a staff member, you know, I'm going to be sharing a few horror stories with you during today's webinar so you could be educated as to what has happened in other offices. But if you have a staff member that becomes disgruntled, they can file a complaint against you. And even if it's untrue, if you have a billing and coding policy manual that everything is laid out step by step, it's hard to be accused of any wrongdoing. Now for the doctor, why would it be a good idea to have a billing policy manual for the business owner or doctor? Well, it's a custom-made document for your particular type of practice. For example, well, in my practice, not all patients, but many patients and many of my clients, when a patient comes in, the patient might say, I have neck pain, Dr. Kotler, that's it. I just have neck pain. I'll check the thoracics, I'll check the lumbars. I have many clients that are activator doctors. They'll check the legs, they'll check posture, they'll check shoulders, and they'll adjust many parts of the body, even though the patient's only complaint was neck pain. So you might only bill 98940, but if I looked at your notes, it might say adjust the cervical, thoracic, lumbar, sacrum, pelvis, the right ankle, right? You have to write down everything you do, even if you don't bill for it. So that could look unusual to a health plan. If they're auditing you, they could say, wait a second, are you down coding? It looks like you're adjusting, you know, every bone in the body, but you're only billing 98940. What's going on? So a policy manual, a billing policy manual, helps describe that. It'll definitely help you SWAN. That's one of my favorite acronyms, SWAN, sleep well at night. And it's also a good idea to have a billing policy manual just in case a state board, come snooping around, if you're accused of malpractice, or if an insurance company is auditing you, it could help prevent audits. It could mitigate fines and penalties. Now, you could look really bad and unprofessional if you cannot prove to an investigator or a state board what your policies are. I've been part of many medical reviews where the actual medical director and investigators are on the phone with me and my clients, and they're asking basic questions. Who's in charge of your billing? What are your office hours? How many CAs do you have? So you want to have everything lined up nice just in case, because you don't want to be caught off guard. You don't want to be made to look silly. So a billing and coding policy manual should have these three essentials. Create billing and policies and procedures, conduct regular staff trainings, and perform patient record reviews. Those are the three most important items in a billing and coding policy manual, or if you want to call it a compliance plan. These are the three. There are other essentials, but to me, these are the three most important. So let me show you how to create a couple of policies right now. One of the most important things to do as far as being proactive and trying to prevent problems, so you could be proactive or reactive. You could, like I know some chiropractors, they don't go to any seminars, they don't go to any webinars, they stay in their office, they're not a member of any state association, national association, they just stay in their own little bubble. A person like that will get caught off guard. They'll get a records request, and then they'll be, really, frustrated and concerned. They'll be, a staff member accuses them of wrongdoing. They don't know what to do. So that's not a good way to practice. I don't recommend that. So what is the other way to practice is to be proactive. Go to seminars, go to webinars, learn, be a sponge. So one of the most important things to do if you want to be proactive and protect your practice is to do internal reviews of your SOAP notes. Yes, internal reviews. So let's create our first policy here. Policy 1.1. We're going to do patient record reviews. How do you do that? Okay, well, first of all, a policy should have a procedure. So you have a policy and a procedure. Policies and procedures. So the policy here is the backbone of any compliance plan is reviewing and monitoring components. Without them, we would not know if we're being successful in our best efforts to be compliant. Therefore, it will be our policy to perform periodic patient record reviews. Okay, that's your policy. Now, what's the procedure? The record reviews will consist of blank number of charts every blank number of months. So fill in the blanks. I typically recommend 5 charts per provider every 6 months. It could be quarterly. It could be 3 times a year. I'd say at a minimum twice a year. These are just my recommendations. And you're going to focus your reviews based on the health plans that you're billing. And if you're not billing any health plans and you're a cash practice, it's different. See, this is a very customized manual. So in this case, you're going to use the correct use of the Blue Cross Blue Shield Medicare guidelines, the difference between insurance covered services and non-covered services, proper use of CPT codes, ICD-10 codes. If any significant issues are identified in the review, it may be necessary to develop additional procedures in order to track and make improvements. So now let's dig a little deeper. You have to do a patient record review. How do you do that? Have you ever done it? Well, this is the way we recommend it be done. We have a spreadsheet. It's basically an open book test, and you're going to score yourself. You're just going to be asking yourself questions. If you take out a routine SOAP note, here's an example of a question, and the spreadsheet that you see on your screen, you would just fill in the yes, the no's, or maybe it's not applicable. So, simple question. On a routine visit, is the patient's name and date on the form? Yes or no? Did you sign the notes? Yes or no? Did you put down the pain scales, the trend, the objective findings? Did you put down the amount of time you spent doing each time-based code? Did you write down the muscles that you are doing the rehab exercises on? Did you write down the specific bones that you adjusted in the notes? So there's a whole bunch of questions that you ask yourself. In this case, there were 32 questions. Out of 32 questions, 29 were answered yes, 3 were answered no, and a bunch were not applicable. So the way you score it is 29 divided by 32 equals 0.90 times 100 is a 90%, or an A. That's what this review was. You see at the bottom of the screen, it shows you the sample scoring method. Let's pick another policy. Staff training. Policy 1.2, staff training. What's your policy? Billing and coding compliance training is essential to any successful plan, and the OIG, that's the Office of Inspector General, has made recommendations for 3 hours of compliance per employee per year. So I'm using the OIG as my reference. 3 hours per year. That's not per day, not per week, not per month. That's per year. Pretty easy for most doctors to have staff members have 3 hours of training. Hey, you could even use this webinar towards your staff training. So what's the procedure? We will provide all employees with billing and coding training. Topics will include CPT ICD-10 code training, record keeping, Medicare billing, etc. And how do you keep track of this? How do you make it formal? See, when I speak to doctors all over the country, do you have staff meetings? I always ask, do you have staff trainings? Do you have meetings with your billing staff, your office manager? Oh, yeah, Dr. Kotler, all the time. Oh, good. Do you write them down? And do you put it in a log? Oh, no. Well, then how can you prove to anyone that you have staff training? Well, who's going to ask me to prove it? Well, if you have a disgruntled staff member quit and say they never train us, but yet you do, you don't have anything in writing. If you have an unhappy patient or a jealous chiropractor down the street report you to the board, you have anything in writing. So here's what you do. It's a simple spreadsheet. You could even use today's. You could fill it in. Whoever is in your office, Allison, Cindy, Ellen. We were on a webinar for 45 minutes today, put in on November 8th. The topic was how to create a billing and coding compliance manual, the length. Put that in your manual. There's proof. Now, you want to provide more than just these types of webinars, because it's a little bit of the the fact that you don't have anything in writing to prove it. Well, then you might say, Dr. Kotler, can you give us a certificate of attendance today's webinar? Of course we can. If you've logged in, we have software that has done a timestamp as to when you logged in and when you logged out. We can give you a certificate of attendance. You know, otherwise it's the honor system. You don't want to fill your training log with, yes, I went on YouTube and I watched 30 hours of billing and coding videos. There's no way to track that. So you want to have a tracking mechanism. If your staff goes to a chiropractic convention, well, now you have proof that they attended. Let's talk a little bit about background checks. Do you need to do background checks? Do you want to do background checks? What's the deal with background checks? Do you have to pay for it? Well, here are the key points as it relates to background checks. Something as simple as, contacting the references. When you are bringing on a new staff member, let's talk about staff members, not healthcare providers. Right now, we're talking about office managers, billing staff, front desk receptionist. When these individuals come in to apply for the position, I'm assuming you have an application that the applicant fills out. There should be an area for the applicant to put down a few references. I strongly recommend you contact those references, even though they'll probably be ringers, right? Why would an applicant put down a reference if somebody's going to, give it a negative review? So they're going to be good, Most of the time. I've dealt with some unusual situations over the years, but call them anyway. Even though they're probably going to be wonderful endorsements, call them anyway. Next, you want to check the social media pages of the staff member that you're about to hire. You're allowed to do that. I had a client of mine was thinking about hiring a staff member, went to the Facebook page of this individual, and this individual was, showing body parts that, my client thought were unprofessional, didn't like what he saw on the Facebook page, and chose not to hire the person. So maybe you want to do that. Criminal background check? Is it really necessary? I mean, I'll leave it up to you. You don't have to. I mean, and it should be done on a case-by-case basis. Let's say you're looking for, a front desk receptionist, and you have a patient that has a child, a high school student, that's going to come by and help you do some front desk work, answer phones, maybe do some filing. This is a patient's son or daughter, local high school kid, is going to come help you out. Do you really need to do a criminal background check on a person like that? Probably not. Well, how about another scenario? Now you want to hire a front desk receptionist that's going to be collecting money from patients, cash, checks, credit cards, and this person maybe has worked in 4 different offices over the last 6 months in 3 different states. Oh, well, maybe you want to do a background check on that person, and they're not expensive if you really wanted to do one. Now, with healthcare professionals, doctors, other, nurse practitioners, physical therapists, I would recommend you get a copy of their license. Make sure their continuing education requirements are up to date. And if you plan on having a healthcare provider, see Medicare patients. Actually, for anyone dealing with anything to do with Medicare, you are required to go to the Medicare OIG exclusions list. I'll talk to you about that a little bit more in a couple of minutes, but that's mandatory. If you see Medicare patients, you must go to the exclusions list and do a quick check to see if the person has been excluded from the Medicare program. So, all right, we're talking a little bit about Medicare. Let me just touch on a few things here as far as creating a billing and coding policy manual. Medicare and the OIG. OIG stands for Office of Inspector General. The mission of the OIG is to protect federally funded programs like Medicare, Medicaid, TRICARE from criminals who are trying to rip it off. And you hear about that all the time. All these different scammers and criminals billing Medicare for services that weren't rendered or for equipment that wasn't supplied. So the OIG wants to protect these federally funded programs. So they do evaluations and reports and data analysis. And there have been some reports on chiropractic over the years which are not fun to read. Hundreds of millions in Medicare payments for chiropractic did not comply with Medicare requirements. So it's not a good thing, as far as a PR perspective to see something like this. So Medicare wants providers to be proactive. So if you see Medicare patients, you are required to go to the OIG exclusions list. So here's your next policy. Policy 1.3, the OIG exclusion list and background checks. Policy, in an effort to curb Medicare fraud and abuse, the OIG requires exclusion list checks to prevent a person who's excluded from participation from receiving compensation. Therefore, it is our policy to comply with this requirement. That's the policy. What's the procedure? We're going to perform background checks. We're going to go to the OIG exclusions list. There's the website. You see it? exclusions.oig.hhs.gov. So upon hire and every year, for every employee that has anything to do with Medicare billing and coding, this is Medicare we're talking about. If you have a staff member that's going to treat cash patients, Blue Cross Blue Shield, you don't have to do this. So here, you go to the website. Let's say you wanted to hire Doug. Doug Godfrey came in for a job interview, and you're going to have Doug see your Medicare patients. you put Doug's name into the exclusions.oig.hhs.gov website, and his name pops up as being excluded. His license, he had to surrender his license. You'll see if you put in some names as to why they've been excluded, it'll show you on this website. So that's mandatory. That's another policy. So that's 3 policies that we've gone through. Just a quick Q&A. Can you treat Medicare patients without being enrolled in the Medicare program and billing Medicare? The answer is no. Chiropractors cannot opt out. Can you collect cash from Medicare patients without billing Medicare? Maybe. That's if the patient gets to wellness and they check option 2 on the ABN form. So just a quick summary here. Chiropractors cannot opt out of Medicare. Chiropractors not enrolled in Medicare, you're not even allowed to use. If you're not enrolled in the Medicare program, you cannot use the ABN form. That's Medicare's property. A little bit about Stark and Anti-Kickback when creating a billing and coding policy manual. These are the things that we include. Even if you're not seeing Medicare patients, it's a good idea to include this. The Stark Law prohibits a physician like an MD, a chiro, a DC from referring patients to an entity in which you have ownership in for designated health services like PT, radiology, DME. Anti-Kickback, it's illegal to give payment or receive payment in exchange for a referral. Next, when you're creating a billing and coding policy manual, well, what's your policy on prompt pay discounts, on time of service or administrative fee? There's a lot of terms. I've gotten rid of all the terms. Most people don't say time of service is sort of an older term. Call the prompt pay discount. So let's say your normal fee or the fee that you bill insurance is $100. Okay, let's start with round numbers. $100. Now a patient comes in, cash patient, no insurance, or patient has insurance but has a huge deductible. So it's basically a cash patient. Your normal fee is $100. How much can you discount? Can you take off 10%? Can you take off $20, $30, 50%? Can you charge the patient $20 if you want and do the same exact services? These are the questions that we get every day here at Target Coding at our help desk. People asking, how much can I discount? I normally bill $100. I want to charge this patient $20. Is that okay? So every state has different rules. Most states don't, and we've contacted just about every state in the country to get their rules and regulations, and we have a long list. Most of them, I can tell you, will say we don't have a policy on it, we don't have a position on it, and they refer you to the federal guidelines. Oh, what are the federal guidelines? Here, this is right from the OIG, about 15%. I loosened my hat a little bit on that, maybe 20%. So normally 100, you want to charge a cash patient 80, that's fine. Shouldn't be an issue. You want to charge them 20 for the same thing, that's not okay. That would be considered a dual fee schedule, and the insurance company could get very upset with that. What about free services? Here's another question we get, Dr. Kotler. We want to give away, a free exam, free x-rays. We want to give away a TV for the patient that refers us the most patients. I went to visit a client of mine not too long ago. I walk in, and in the waiting room, from the ceiling, is a very expensive mountain bike. I think it was like a $1,200 mountain bike. And this client of mine has a contest going on. The patient that refers the most other new patients to the practice is going to win this $1,200 bike. Is that okay? Can you give away a $1,200 bike? Can you give away free exams? These are the questions we get here every day at Target Coding. So there's something called the $75 rule. Where does that come from? This is what I have. Now, I have positions and opinions from many states, but oftentimes the state board will say, we use the federal guidelines. So the federal guidelines say you can give a gift to a patient, like Mrs. Jones, thank you for referring your friend, your neighbor. I would like to give you a gift. Here's a water bottle, tickets to the movies, a t-shirt, a $15 gift card to Starbucks. Can't have value of more than $15. Now this relates to Medicare patients. So here's the next question. Well, Dr. Kotler, can we give away a $500 flat screen TV to our Blue Cross Blue Shield patients, our cash patients? I don't have anything in writing from Blue Cross Blue Shield on that. What I have in writing is from Medicare. Be careful with free services. Now, when you're creating your billing and coding policy manual, how do you handle free services? Well, this doctor got in big trouble. This doctor gave away free electrical stim to his Medicare patients, and he was fined $80,000. Doctor has agreed to pay $79,919 to resolve allegations he violated the False Claims Act and the Anti-Kickback statute by improperly billing Medicare for chiropractic adjustments after providing free electrical stim to influence those patients to receive chiropractic adjustments. So the U.S. Attorney Office in Iowa went to this doctor and said, hey, you are using the free stim to induce the patients to come in for chiropractic adjustments. So be careful with the free services. Deductibles, copays, you know the deal. Deductible, copays, coinsurance, they must be collected. Routine waiving of deductibles and copays is not okay. Once in a while, yeah. Case by case, yes. Patient has a financial obstacle, yes. But on a regular basis, it's not okay. And guess what? It's becoming a big deal because more and more health plans are checking into this. Here's a letter that a doctor received from Medicare. It says, the purpose of this letter is to inform you that our office received a complaint. Who filed a complaint against this doctor? Who did it? Was it a disgruntled staff member? Was it an unhappy patient? Was it a jealous doctor down the street? Somebody filed a complaint against this doctor. It says our office received a complaint alleging that you knowingly process Medicare claims as if the patient is paying their copays, but the patients are not. That'll get your attention. Here's another letter one of my clients received. Dear Billing Department, Cigna periodically reviews records to verify the accuracy of claims. Please include the following: copies of patient billing and collection ledgers, documents that show when bills were sent to patients, if any, and how much has been paid by the patients. Here's some additional essentials you should be doing. Besides those 3 that I showed you, here's a few more. Name a compliance officer. Doctors, if you don't have a trusted staff member, then name yourself the compliance officer. Make sure you have open lines of communication. Give that impression that you have an open door policy. A staff member has a problem about something, they should be able to come to you without retaliation. You're not supposed to fire a staff member because they give you, a concern or a recommendation. Make sure you have something in writing in your policy manual about how you enforce disciplinary actions, how you respond to detected violations. Have a form on, a patient, an employee signs. It's called the Employee Policy Acknowledgement form, that they understand your policies and procedures. If you're going to have a staff member be the compliance officer, you should have a separate form that they sign that they're taking on the role as compliance officer. You should have a log or a form on everybody that has access to your computer. Training logs I showed you. You should have employee concern forms, patient complaint forms. If a patient says, hey, you billed my insurance company for a service, I wasn't even in the office. That actually happened to me once. You should have something that you could put down in writing, formally document it. Patient says, you ripped off my insurance company. I'm never coming back here again. You should document those types of situations, and hopefully they happen very rarely. Alrighty, I'm going to close with our 9-step action plan. Step 1, get proactive. It'll help you sleep well at night. Don't wait for the knock on the door. Don't wait for an insurance company to ask you for your notes to take a look at your notes to see if they're okay. Step 2, get all new patient forms signed. Make sure the patients totally complete all the forms you give them. Review all the forms before you go in to see the patient. Doctors, you should review the forms. I do this all the time with our clients. Sometimes the patient will check off on their history form, I had a concussion. I have dizziness. I vomit. Every day. Patients could be checking things. You're supposed to review that. You can't shrug it off. Review the patient paperwork. Review all the forms. And yeah, there's a lot of forms that patients need to fill out. Make sure you have good quality forms that make sense, that have been updated. That's one of the things that we do here at Target Coding. We have a forms packet that we sell. We give it to our clients, our gold member clients. You need to have updated, good, clean forms that protect you. HIPAA forms, notice of privacy practices. Yes, if you need one, let us know. Here's a sample of it. Get a good notice of privacy practices. Make sure the patient fills out all your financial forms. Step 4, review the policies from the insurance companies you bill the most. I call it the 35% rule. If you're collecting more than 35% from one particular insurance company, make sure you know the policy on that from that insurance company on the services. If any of you are billing physical therapy to Blue Cross Blue Shield, we're talking about Anthem or your local Blue Cross Blue Shield carrier, and you're billing for, let's say, therapeutic exercises or traction, manual therapy, make sure you read CG Rehab-04. Step 5, understand the what and the why. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing it. Make sure they pair, like wine and food. Make sure your CPT codes, your diagnosis codes link, combine. If not, and you get audited, you'll have to give the money back. I wrote a book on how to pair your CPT codes to your diagnosis codes. Also in the book is this, here's a page out of the book that gives you a diagnosis, and then it gives you the neuro, the chiro, the subjective findings, the ortho findings to help substantiate. For example, you're going to diagnose a patient with cervical radiculopathy. Make sure you do a little Jackson compression, foraminal compression, check range of motion, check reflexes, check for myotomal weakness. That'll help you justify your diagnosis. If you diagnose, I was just reading through a doctor's report the other day. He diagnosed the patient with cervical radiculopathy. Okay, fine. It's a pretty common diagnosis. I'm looking at the examination. The examination under range of motion, it says normal. Cervical range of motion, normal. Upper extremity range of motion, normal. Soto Hall, normal. Foraminal compression, normal. Cervical distraction, normal. Everything was normal, but the doctor diagnosed the patient with cervical radiculopathy. It didn't make sense. This is the book I wrote. It's an excellent book. We recommend it highly. It's our best-selling book. We've sold thousands of these books. If you order the book today, we'll waive the shipping and handling. Step 6, do a self-test on your SOAP notes. Make sure you know what a medically necessary SOAP note looks like per insurance company. Every company has different requirements, right? Medicare has different SOAP note requirements than United Healthcare. United Healthcare is different than Cigna. Cigna is different than Aetna. Step 7, always keep learning. Be a sponge, attend seminars, webinars on a regular basis. Always keep learning how to improve your business, how to help more patients. Step 8, put together a simple billing and coding policy manual. I just showed you how to do that. Step 9, conduct regular meetings, especially with the staff members that are billing the companies that are paying you the most. If you're using a billing company, do a spot check. I've had a few cases over the past 2 months where doctor is being audited, didn't know why, It's because the billing company was adding modifier 59, adding CPT codes that weren't done, changing 98940 to 98941. Why? Because the billing company makes more money that way. It's illegal. Careful. Do a spot check. Again, you want to do all these things just in case you get a knock on that door. You want to make sure you can swan, right? Sleep well at night. There's my favorite acronym. Check with all the carriers you bill prior to submitting claims. We can't guarantee this information will guarantee payment from any insurance company or patient. I want to thank everybody for attending. We're going to get to questions now. Here's our contact information. There you can contact me directly, Dr. Kotler at targetcoding.com. Website, targetcoding.com. There's our telephone number. We're on all social media platforms. Follow us on Instagram and Twitter. Like us on Facebook. Check us out. Oh, by the way, if for some reason you really like this webinar and you wanted your staff members or other doctors or your friends to watch it, it's going to be uploaded a little bit later today to our YouTube channel. So just go to targetcoding.com, click on the little YouTube icon, and you'll get to watch this webinar again. Now, members of Target Coding can get all the slides. Non-members, you could watch the video, but you can't get the slides. Besides webinars, we do a lot of things here at Target Coding. Besides these webinars, we do seminars all over the country. We sell videos. We do on-site consulting. We have member programs, gold, platinum, silver memberships. Hey, you could even hire us for an hour. We have a package of forms, letters, and templates. All of these things are on our website. We install HIPAA compliance programs. We create Medicare compliance programs, not only for doctors of chiropractic, but for acupuncturists, physical therapy centers. Oh, speaking of seminars, we have a seminar we're doing on a cruise. Yes, we're doing a seminar on a cruise ship. 8 CEUs have been approved in about 30 states. It's a 4-night cruise. It leaves out of Fort Lauderdale, goes to Mexico, Cozumel. Bring your staff, bring your family. It's $149 for the whole office for the seminar. So doctor, it's $149 for you. You'll get 8 CE credits if your state has been approved. If you want to bring you have 10 CAs, you could bring all 10 CAs to the seminar. It's the same price, $149. Now, if you want to maximize all the social amenities, all the little gifts, all the little giveaways, contact Vicki. She's the travel agent that's getting us a great group rate. There's her contact information at the bottom. This is our Smart Choice program. It takes about 2 months. It's a short-term project where we evaluate your entire practice as far as billing, coding, documentation, Medicare, HIPAA. We give you our recommendations and suggestions. It's a quick review. It'll help you swan. Here's our forums, logs, templates. We include over 75 chiropractic, physical therapy, acupuncture, Medicare, HIPAA forms. They're broken down by new patients, admin, exams, a whole bunch of like 10 sample soap notes, a bunch of letters of medical necessity, fight back letters, appeal letters, physical therapy, acupuncture, a whole bunch of Medicare forms, letters, ABNs, and 23 HIPAA forms. We get this question all the time, Dr. Kotler, who do you recommend as far as billing companies go? ACOM Health. We recommend them for your chiropractic insurance billing needs. Give them a call. They have a package they've put together. Mention you attended the seminar, and you'll get a free analysis, fee analysis. Here's the book I was talking about again earlier. A whole bunch of FAQs and how to pair your codes and which codes pay the most, and cheat sheets are built in. Has all the updates, all the new updates as of last month. And I mentioned earlier, we sell videos, books, forums, compliance manuals. Our billing and coding compliance manual, like I mentioned earlier, try and create one on your own. Based on this webinar, how to create a billing and coding policy manual, you should have a really good start. I gave you a whole bunch of things to do. Start working on it. And if you got it all figured out, fantastic. If you're going through it and you're having some bumps in the road and you want assistance, contact us. We're offering a special on our compliance manuals and Medicare policy manuals. So again, I want to thank everybody for attending. I hope you learned a lot. Let's take a look and see what questions have come in.